While the state is yet to witness community transmission, cluster transmission of COVID is a reality in Manipur. Speaking exclusively to Northeast Live, Additional Director of Health Services, Manipur, Dr. Sashikumar said that it has been a mixed bag as far as the overall COVID situation in the state is concerned. Dr. Sashikumar informed that so far over 90,000 samples have been tested in the state and close to 3,000 found positive. The Additional Director of Health Services admitted that since a month now, the positivity rate in the state is accelerating and the trend is indeed worrisome for the department.
The direction in which the pandemic is moving in the state is in the expected line. The speed with which the number increases is slightly worrying in the last few days. Otherwise, we are keeping things under control. The positivity rate per lakh population is 97.38. That means we are neither in a very serious trouble nor we are in a very minor state. We are in the middle of many other comparable states. Then the cure rate per lakh population is 58.86. This means our cure rate is better than the average level, and we are not very far behind the best of the states. Now, so far, our state has tested 89,403 individuals. The positivity rate is 3.27%. We have 467 total armed personnel from the central forces. That means roughly if there is one locally transmitted case, there is one armed personnel imported from outside.
He also reiterated that till date there is no declaration or announcement of community transmission in Manipur. However, local transmission or cluster transmission has already been taken place and around 450 persons without travel history have tested positive in the state.
The last few days, from many quarters, including the political leaders, we have heard that there is community transmission in the state. I have also even heard that we are on the verge of the community transmission. And with these announcements, the people are sometimes worrying whether we are going beyond the control level. That is not so. Officially, there is no declaration, there is no notification that there is community transmission of COVID-19 in the state. Yes, there are some indications in which it can be assumed that if proper preventive interventional measures are not taken up, we are likely to have community transmission in any moment. As of today, we have 450 are confirmed as COVID-19 positive, but they do not have any significant travel outside the state. Now, out of 3,000 people, we have 450 people. That means 1/6 of the total positive people are locally transmitted cases.
Dr. Sashikumar added that the state government is trying its level best to ensure that there is no community transmission in Manipur. Moreover, around 15 COVID care centers have been set up across the state to accommodate asymptomatic patients.
The government has increased the COVID care centers. Now in our state, we have 15 COVID care centers. That means for every 2 lakh person in the state, we have one COVID care center. Therefore, our measures to deal with the COVID care, COVID patient facilities is not that low. On the other hand, I would rather say it is a good number. As such also, we have the 2 big hospitals, RIMS and Jennings. They are doing their utmost for the care of the serious COVID patients.
He further added that rampant use of sodium hypochlorite as a disinfectant spray may have adversely impacts, and people should seek medical advice before using it.
There is rampant use of disinfectant called sodium hypochlorite. It has been used unsupervised, so much so that I have seen that in many areas, the drains, the fields, the roadsides are sprayed with this disinfectant. Now, this disinfectant, if it is used properly under medical guidance, the effect is tremendous. It is very, very beneficial for us, especially in the fight against COVID-19 pandemic. However, if it is wrongly used, as it is done in some other parts, it will bring harm to the common people.